My name's Julie and I work for social and healthcare as a family support worker within children and families. I started working at a secondary school with teenagers with attendance issues. After going in and doing home visits with the families, I realised that there were lots of issues within the community. Lots of children have got problems with their parents being addicted to drugs and alcohol, and many suffer issues of neglect. Often the cases that I work for are 16-year-olds who have been asked to leave the family home on their 16th birthday. In these cases, we have to get connections involved and work alongside the housing projects to make sure that they've got accommodation and opportunities for training. We also make sure that they've got life skill training also so that they can look after themselves, work out their budgeting, do their own laundry and get to their appointments on time. I got some experience working for 2 years within that environment and then started at social and healthcare. In that way I could address the whole of the problem within the family, communication problems between parents and their children and basic parenting techniques. When a case first comes to our team, the manager briefs the person who the case will be allocated to. Usually a conference has already been held at that point with other professionals including the police and youth offending team, education, teachers and GPs. A plan's put together and then we work the plan, we make sure all of the points on the plan are implemented, and then another conference report is written by myself after liaising with other professionals and working with the family, and then we submit that report at the next conference. All team members have their own unique qualities and their experiences are drawn upon and cases allocated appropriately. I work mainly with teenagers, so most of my cases are working with teenage children. However, they also do throw in some other cases where you can get extra experience. I've got 2 cases where I've got newborn children and also some contact cases where children who are in foster care need to have supervised contact with their parents. The training opportunities here are absolutely fantastic. There are lots of one-day courses and seminars that are held regularly. Our team also believe in Grow Your Own, and so they put opportunities forward for you to actually take your degree once you've been within the team for a while and you've gained your experience. I've recently been accepted for work-based training, so they're agreeing to fund my place. I've also been accepted onto the Ruskin College course and I start there in September. That will mean that in 3 years' time from September I'll be a qualified social worker. I can then take on child protection cases and do court work. I love the variety. There's always something happening. On certain days you can come in, you can get on with your work quite quietly, do your writing of observations. Other days it's all sorts of problems happening within families and you have to react very quickly. I worked with a young girl who was going into adoption. She had had quite a tough time at home with her mum. Her mum basically didn't have the skills to look after her and so she was left fending for herself quite a lot. I did some life story work and we worked together, put in a story together of her whole life. We put in pictures of her family so that's something she can take through to her teenage years and have a little understanding of what actually happened in her childhood. It was very emotionally demanding, however it was extremely rewarding. She's a very nice girl, she's very settled in her new home, she gets to see her mother still and she's still continuing her life story book.